Mr. Gowdy.
Thank you, Mr. Chairman. The debate over the role of government in our republic is a fascinating one and probably outside the boundaries of a 5-minute Q&A. What is not debatable is if government is going to enter into something, we have a legitimate expectation that they do so competently and in a trustworthy fashion. So, Dr. Thomas, let me start with you. What do you think the largest avoidable mistake was with respect to the rollout of the website? The largest avoidable mistake.
I am not qualified to speak to that. I am not knowledgeable about the technological aspects of the website.
Neither are the people who drafted who designed the website, apparently. You have no thoughts on what the largest avoidable mistake was with respect to the website.
I do not.
Dr. Calabria?
I would preface with the same that I'm not an IT expert. I'm not an expert on the website, but so I certainly would say the sense you had to have it running by a certain date rather than having made sure it was ready before, I certainly think is a mistake, but I would emphasize what Dr. Thomas said, not expert on the website.
Well, let me ask you this then. If you're not an expert on the website, it strikes me that if there's a security issue with Amazon or eBay, the consumer has recourse. There are consequences for that. What are the consequences if there are security issues with a government website? I mean, you can argue that there would be electoral consequences, but we had a several-hour hearing, and I still can't tell you who was responsible for the website. I can tell you it's not the President, it's not Kathleen Sebelius, it's not any of the people that you would think would be responsible for this train wreck. So what does a consumer do when they are let down by a government website?
And I think that's an important point, and both Veronique and myself talked about the role of incentives here, which is, I mean, A, there's often not clear chains of authority. I mean, the buck should stop somewhere with something, and there's never any, penalty. There's never any punishment. Certainly not the website. I mean, alone, we've all heard the stories of NSA spying and going through, what we're all looking at and on the web, but I haven't yet heard of any NSA employees being disciplined for that.
I got one even worse than that. How about the GSA? Do you remember the picture of the gentleman with a glass of wine in the hot tub?
Oh, yeah.
Do you know what consequences came from that?
I believe they rehired him, and of course I'll also say, as somebody who follows financial services, you have probably heard of the very large number of SEC employees who spent the financial crisis looking at porn sites on their office. None of them were fired. So again, where is the accountability? Where does the buck stop? Is an important part of this question.
Dr. Winston?
I mentioned in my testimony that story that I read about an IT supplier who offered to build this website at no cost. I can't remember exactly now the name of the firm, but they had a lot of experience doing it. And I'm sure we could find that out. But they were told they couldn't do it because of regulatory constraints, and then the government went out and hired another firm. At the very least, one could have brought them on as a technical consultant or somebody who could provide guidance, because they certainly were confident enough and experienced enough to do it. So I think clearly an avoidable mistake was just the lack of ability to bring in the highest level of technical advice and competence, which apparently may have been able to prevent some of the problems that occurred.
Well, it just strikes me that you can debate the role of government, but if government's going to do something, you really should not debate whether it ought to be done competently and in a trustworthy fashion. And there are no consequences, or if there are, I haven't seen them today. With that, I would yield to the Chairman.
I thank you for yielding. I just want to get two things in the record quickly. One of them is, because there was the doubling of life expectancy, I just want to get into the record. In 1960, we spent 5% of GDP on health care, and we had a 69.7 combined life expectancy age. In 2006, we spent 16%, a more than threefold increase in the percentage of our growing GDP we had. We became very wealthy during this period, but we exceeded it by triple. and we raised ourselves by 8 years to 77.7. Mr. Calabria, Dr. Calabria, quite frankly, isn't that what we should be talking about, is how we spend more than 3 times the growing wealth of our nation on health care, and yes, we're getting an increase in life expectancy, but certainly not proportional and not when you look at our competitiveness around the world, where countries like Canada to our north spend a third to a half less than we do.
I would very much agree. You could certainly say that we're spending a lot of money on these things, but what are we getting? You know, we're getting a bang for our buck, and we could do a far better job of that and trying to get more efficiencies out of that, which I think gets back particularly to Congressman Mica's point about having some consumer choice in this, you know, to me is an incredibly important part of it.
Dr. Thomas, my colleague said something, and I'm taking something because he said it, and he's rightfully so. He said universal health care. The debate that we are having today is on something that's not universal. It's an extension of Medicaid, effectively. It's a vast expansion of Medicaid, both in literally who gets it and in this subsidy that is effectively a backdoor Medicaid for the working, less wealthy, up to over $60,000. From a standpoint of your view of the good it's doing, it is predicted we will get to 20% to 21% of GDP as a result of the Affordable Care Act in total health care spending. Would you sit here today and say that our goal should be to deliver life expectancy beyond 78 years and do it for less than 21% of GDP?
I would respond to that by saying that our health care spending, we are living longer than ever before, and much of our health care spending is to deal with the chronic diseases of old age that we used to not have to deal with because people were dying earlier.
Okay, well, my time has expired, so does anyone want to answer the question, which is, should we have a goal to live long, live well, and do it at a rate below 21% and growing, or likely to be 21% and growing percentage of GDP, when we're competing against nations that have 9% or less and have life expectancy as long as ours? Hearing none, I will recognize that my time has expired.
Mr. Chairman, could I correct one thing very, very briefly that my friend from Virginia told me that there were consequences that arose from a hearing that we had with respect to GS8. If my friend from Virginia tells me that, I believe him, and I will take it upon myself, Mr. Chairman, to find out the full panoply of the consequences and report back to you and to my friend from Virginia.
I thank you, and I don't think there's anyone here that would fail to think there should be consequences in the case of GSA. And with that, we go to the gentlelady and my friend from the District of Columbia, Ms. Norton.
Thank you, Mr. Chairman. Just